Most doctors accept Medicare because most patients over 65 have it. Question 4. How much does Medicare cost? Part A is free for most people. Part B costs $185 monthly in 2025, more for higher income earners. Part D varies from $15 to $100 monthly. Medicare Advantage plans often have zero premiums, but include all costs. Question 5. What if I miss enrollment deadlines? You get permanent late penalties. Part B penalties are 10% monthly for each year late. Part D penalties are calculated differently, but also permanent. Creditable coverage can prevent penalties if you prove continuous coverage. Question 6. Does Medicare cover dental and vision? Original Medicare covers very limited dental and vision, mainly for medical conditions. Many Medicare Advantage plans include these as extras. Separate dental and vision insurance is available, but evaluate costs versus benefits. Question 7. Can I travel with Medicare? Original Medicare works everywhere in the United States. Medicare Advantage typically only covers emergencies outside service areas. For frequent travel, Original Medicare with Medigap provides most flexibility. Question 8. What's the difference between Medicare Advantage and Medicare Supplement? Medicare Advantage replaces Original Medicare with private insurance, including drug coverage and often extras. Medicare Supplement works with Original Medicare to fill gaps.